So there might be some conditions where an individual might actually need just a specific clotting factor. All right, they are just deficient in a specific clotting factor. So we're actually coming to the days of modern medicine, where if somebody needs a component of blood, you don't go administering a whole blood to them. You might just want to just concentrate what they need and give just what they need to them. So if an individual is deficient in factor 8, you concentrate factor 8, give to them. If they're deficient in factor 11, you concentrate factor 11 and give to them. If they are deficient in factor 10, you do like that, right? So let's look at the specific clotting factors. Look at how this is done. Examples of clotting factors that would maybe concentrated and be given to people who have specific what disease conditions. So this now we said that these are what purified and concentrated preparations of individual clotting factors. Okay, and if you are doing this, you want to treat specific bleeding disorders. All right, so a particular bleeding disorder might come into play if you are deficient in a particular clotting factor. Another one will come if you are deficient in a particular clotting factor. Okay, so you are basically doing this to attack specific what clotting problems that might actually come up. Okay, so we have factor 8 concentrate. That's if the person is having hemophilia A, you might want to administer factor 8 concentrate. If they are having hemophilia B, you might want to administer factor 9 concentrate. Okay, if they are having hemophilia A and B, okay, with inhibitors, you might want to administer what factor 7A concentrate. That's the activated factor 7 concentrate. Okay, then if you have a factor 11 deficiency, you simply administer factor 11 concentrate. Okay, then if you are having inhibitors for what activated prothrombin complex concentration or hemophilia A or hemophilia B, you can just administer the activated what prothrombin complex concentrate. Okay, so indications is just like us talking about these things in bracket now. That's like medical problems in which you might need to actually do these concentrates to administer. If the person is having what hemophilia A, that means they are having deficiency in factor 8, so you administer it. Hemophilia B, that means they are having deficiency in factor 9, you administer it. Hemophilia 11, sorry, factor 11 deficiency, you administer factor 11. Bleeding disorders with specific factor deficiency, you spot out the factors that is deficient and try to concentrate it. Okay, then also if they are having inhibitors to specific clotting factors, you might want to what administer that factor more to tackle the inhibitor stuff. Okay, so this is what the intrinsic blood clotting pathway and the extrinsic blood clotting pathway. We've spoken about this numerous times, uncountable times. Okay, so this is where the clotting factors come in play, all right, to lead to clot formation. All right, so for you to know which factor is deficient, it's good for you to actually go to the root cause of the disease, and you must have a good knowledge of this pathway. Okay, contraindication in individuals where you shouldn't use this. If the individuals have non-allergy to specific clotting factors, you don't do it. If there's presence of neutralizing antibodies to the specific clotting factors, you don't do it. Then administration, how is it done? Dosage and administration may vary depending on the specific factor and the patient's needs. Okay, infuse slowly, usually over 15 to 30 minutes. Then as you are infusing, you are monitoring for adverse reactions like what? Allergic reactions and thrombosis. What are the advantages of this? Advantage of this is what? You are targeting therapy for specific disorder. So you are targeting it. You are not just going randomly administering whole blood that will lead to too much blood in circulation or iron overload and all the stuff. Okay, so you are targeting something. Then there's also reduced risk of transmittable or infectious diseases, which could be found in whole blood. Okay. Then trying to store these factors, it will be much more easier. So you have a convenient storage and handling of these factors. Okay. Then advantages is that there's a high cost. Okay. There's a high cost. There's risks of inhibitor formations. That's what you have. Antibodies will be formed against the clotting factors. Then this actually requires what? Careful dosing and monitoring to avoid thrombosis or other adverse effects. Okay, so guys, that's quickly all about the specific clotting factor concentrate for blood transfusion. See you guys pretty soon.